Joining me on Doctor's Corner is Dr. Helene Bertrand. She is a retired family physician who has spent the last 10 years concentrating on treating pain. She has invented a new way to examine for and treat low back pain. She has given many lectures on this very subject. She has just finished a research project proving that the new way to treat low back pain works better than any other project or way of doing it now. Welcome, Dr. Bertrand.
Well, thank you, Christine. It's nice to see you again.
Yeah, so welcome back to Doctor's Corner. And now I'm a runner and I'm curious to know, like other runners, do many runners experience back pain?
A whole lot of runners experience back pain, but um, mostly it's because most people in the world experience back pain at some time or other. Like about 8 people out of every 10 will have back pain in their lives.
Wow.
But the reason runners have low back pain is because of this. You see, every time your foot hits the ground hard, that blow is sent right up to your pelvis. And the pelvic bones have to absorb the shock of that blow, of every single step you're taking when you're running. And that's why runners have low back pain. And if you want, I'm going to show you on a skeleton what happens when you're running and, and why you have pain, and also why doctors can't make the diagnosis. And I'll show you. I'm going to set up a temporary table here. And I'll put on this here, and then I'm going to put the skeleton on here. Okay, there you go. I sure hope it holds.
Is it because of running as a repetitive motion? I know it's high impact, right? As well.
Yeah, it's high impact, and here's what happens with the impact. You see how this bone is?
Yes.
This bone is going up and down. Well, that's what's causing the problem. I think I'll get a little closer. I think it'll be easier for you to see. I hope I can. This is jury rigged. Okay. But you see how the impact makes this. You see, this is the sacroiliac joint here. You see, and this joint is hit by the impact all the time. Now I'm going to take this bone out, but the other thing I want you to look at is all the muscles that are here attached on this bone and attached on this one. These guys here attach on this here, and they're trying to stabilize this bone. And in the front here, you've got another big muscle, and it attaches here. And it is trying to stabilize this bone. Now, this muscle here pulls the leg up. So when you see, it goes from here to here, and it pulls the leg up. So when you're going upstairs, you'll get pain in your groin if you have tendinitis in this muscle. See, on this side, you've got these two muscles here, and they're here on your hip here, okay, your greater trochanter. And so a lot of people whose pelvic joints are unstable will complain of pain in their hip, but it's not their hip that's hurting. It's tendinitis of these muscles that are trying so hard to stabilize this joint. And so these are the things that people won't complain. It's not so much their back pain that's hurting so much. It's going to be their hip. And these people are going to have pain when they're sleeping, because they're lying on this. And this is what hurts when they have displaced sacroiliac joints. Other people, you see these muscles here that attach on this bone here? Okay, and you see it?
Yes.
Okay, Well, this is where I'm afraid that this is not working very well. This here is your sits bone. Okay, this is what you sit on, and it's also part of your sacroiliac joint. Okay,
Mm-hmm.
now the muscles that attach on your sits bone are called the biceps femoris or your hamstrings. Okay, and these muscles hurt when you're running, and they hurt because your foot is hitting the, you see, like this. So that's why you have pain when you sit, and you also have pain in your knees where these muscles attach. And so when you are when you have an unstable joint here, all these muscles get to work. And so you'll have pain in all kinds of other places that,
Mm.
like now I'm going to see if I can get this. I'll try and get this out off here and see and show you what the joint looks like, okay? Because I think that's important, okay? Because that's why, and I'll put this away.
It's fascinating, Dr. Bertrand. And
I'll put this away and I'll show you why people, you see this joint here?
mhm.
That's the sacroiliac joint, okay? And if you look at it, you'll see it's very irregular. It's full of bumps and hollows, and goes in and out and so on. And that's why it can't be seen by the x-rays or by the MRIs or by the CT scans. It's so irregular that these modalities cannot see it. The only way you can find out about this joint is if you examine it. And what I do when I examine this joint is I'm checking for this bump here, because then you see, I can tell whether the bone is forward or backward
Mm.
just looking at this bump here in the back. Okay. And
Mm.
I'll show you how to look at this bump. You can feel for it. You can just put your fingers up until they come up against, okay, here it is, okay? Here it is, and here it is. You see how my fingers are coming up against this bone?
Yes.
You see my fingers going up?
Yes.
Okay. Well, that's what you're looking for. And you see, mine should be level by now. Okay, let me see if they're level. I think they're level. You can look in the mirror, by the way. You can look backwards in the mirror like this and see if your bones are level. And if one of them is too high, then you know that you've got to fix it. Or if it's too low, particularly if it's, you see, if you push hard, if you're out of if you're out of position, if you push hard and you're out of position, then if you push hard and you're out of position, then you're going to find that the pelvis is too far forward or too far backwards, okay? And the side that's too far forward or too far backward is going to hurt. And that's what you want to, change, okay? Now, if it's too far forward, you need to push it back, okay? If it's too far backwards, you need to pull it forward.
Lord.
So,
So, mm.
so there are many ways of doing what you need to do, okay? The most important thing to remember is if it's too far forward, you want to use your thigh. You want to use your thigh against this bone. Okay, so let's see if I can show you. You see, if you put your thigh here and you lean forward, then the thigh is pushing this bone backwards. Okay, so
Mm.
that's what you do for a bone that's too far forward. Okay, now if it's too far backwards, what you want to do is you want to stretch your thigh as far back as you can to pull the bone forward. Okay, now I'll show you two exercises that you can do if you want to do that. Okay, so one of them is this one here. Okay, let's see. Can you see the chair? Yeah. Okay, you're going to put your foot on the chair, and then you bend your knee, your other knee, to touch the front of the seat. Okay, then you grab the seat with both your hands, and you lean back, and you pull
Mm.
up hard with your hands. Okay, so that pushes the thigh into this bone. You have to hold it for 2 solid minutes.
2 solid minutes.
Two
Okay.
minutes is a long, long time. What I do is I use my cell phone timer, and I time myself.
Yes.
Okay, well, I don't need to do it for myself now because I don't have any back pain anymore. But for those who do, time yourself for at least 2 solid minutes. Okay.
And
Now,
how many times, Dr. Bertrand? How many repetitions would you do it for?
no,
Like
no,
what?
no, 2 minutes is all you need.
Oh, but will you do it like once, twice, or just one time for 2 minutes?
Once for two
Oh,
minutes,
perfect. Okay.
and and then and then if you still have pain, check your back again because it could be that you've pushed yourself too far back, and
Yes.
then you're going to have to do the opposite exercise.
Yes.
This will only happen if you're very hypermobile, like if you're very, very, very flexible. And people who are very, very, very flexible, um, that's a real problem, uh,
Mm.
because because they're the ones that will get pelvises that move, in the wrong way. And I'll show you why. I've got some illustrations, and I'll show you why. Okay. But you see, a whole bunch of people get low back pain, um, and, and like people, for instance, women who are pregnant, because there's a hormone when you're pregnant that loosens up your ligaments to allow the baby's head to go through your pelvis.
Mm.
Well, that's very nice when you're pregnant, but afterwards,
Oh,
so good. That's
no.
how back pain started anyway.
Yes.
Okay, so now I'll show you another exercise that you can do. Okay, now this one is much, much better on my YouTube video. I mean, this is not the right place or the right way to do it, but I'll show you anyway. Okay, so you put your foot here in front. This, by the way, this is going to be the side that's too far forward. So you're going to be leaning on top of it, okay? And the one that's too far backwards is in the back here, okay? So now you put your hands on either side of your foot, and you put your knees way back to stretch your thigh way back. And then you lean hard forward on this thigh to bring it, to push that pelvis backwards, you see.
Backwards.
So this is to bring this backward pelvis forward, and this is to bring the forward pelvis backwards. You see what I mean? And
Mm-hmm.
hold that for 2 minutes.
2 minutes.
And again, make sure it's 2 solid minutes, okay?
Yes.
And you have to feel a real pull in your groin. Like if you're not feeling a pull in your groin, then you're not pulling on that bone to really pull it forward, okay?
Yes. And Dr. Bertrand, we will have videos, your videos in the segment for our viewers too. So we'll do that as well. But great demonstrations, Dr. Bertrand. And
I just wanted to show you why the pelvis is so important, okay? So here are the pelvic bones, okay?
Mm.
And you'll notice, if you look here, this is what holds your hip joint, okay? These are the ligaments that hold your hip joint. And these are the ligaments that hold your pelvic joints. Look at how little collagen you've got here, because these ligaments are made up of collagen, okay? And look at how much collagen you've got here. This is because these guys are your body's main shock absorbers. They're absorbing the shock of every step. And there's no other area in the whole body that has so many ligaments holding it. And this is why it's so important, like you really have to make sure that, and I'll show you the muscles that are involved, because I was showing them to you on the skeleton, but here they are. You see, look, you see here are the muscles that attach on this bone and attach on the hip, okay?
Mm.
The gluteus, the piriformis, these are all muscles that'll get tendonitis if those joints, if those ligaments, those many ligaments are broken. And you see, and these are the ones that cause problems when you're lifting up your legs, because they're give you pain in the groin. You see, because they're also important in stabilizing the front of the joint, okay? And then people will say, oh, it's your lumbar spine that's hurting, when in fact, this muscle here that attaches on this bone is the one that's hurting, and yet you're getting pain in the back. So if you have a tendonitis here, people will say, oh, no, it's your lumbar spine. No, it isn't. You see, and here are the hamstrings.
Oh, yes, the hamstrings.
Hamstrings. Okay, here they are, the sits bone and the knee. And this is why you get pain in the sits bone area and the knee when you have low back pain.
Mm.
And it's not because of sciatica. Now, there's something else that happens when you have low back pain. And this is this one here. You'll notice here, there's a little nerve. Can you see the little nerve?
Yes.
Okay, and it's traveling down here to the side of the thigh. Some people who have a displaced pelvic bone, okay, this nerve gets squished when that happens. And when the nerve gets squished, then they have burning pain on the side of their leg, right here. They have the people with this displaced thing will have this here. This whole area is going to be burning.
Hmm.
And people call that neuralgia parasitica. Well, sorry, but nobody's connecting the dots that in fact it's coming from a displaced pelvic bone. The instant you put it back, it goes away. And this is important, and yet nobody knows about it.
But it's a healthy pelvic, right? It's having that healthy pelvic.
You have to keep your pelvic bones level. If they're not level, they're going to be giving you trouble.
Yeah,
And the muscles that attach are going to be getting tendonitis. So, and this is, a lot of people don't know anything about that. And in fact, a lot of doctors don't know anything about that.
and here you are, it's like innovative, it's such great information. Now you mentioned pregnant women, runners who get back pain or low back pain, who like older adults.
Older adults, yeah. Well, I was telling you, this pelvic joint here is made up of collagen.
Yes.
Well, when we get older, we lose collagen. The collagen that holds up our skin doesn't work quite so well. You don't have enough of it. Well, when you lose collagen here, these bones aren't held up properly. And this is when you get back pain. Now, the other thing that can happen is if you have an accident, you fall on your bum, boom. So you fall on your sits bone and you rip those ligaments, okay? Or you can have a car accident with your foot on the brake. You're pushing on the brake and all of a sudden this bone gets displaced, like I showed you before, Or you can be hypermobile. You can be, your joints move too easily.
Flexible, right?
You're too flexible.
Yes.
And then your bones can go out. These are all conditions. And then, of course, pregnancy, I was telling you about.
Yes.
So these are all things that can cause these joints to go out.
Well, I mean, how do you, how do you diagnose? Like, I mean, and treat low back pain. You showed illustrations, but um, is
How do
there?
I diagnose it? I've got one to show you. This is how I do it. Okay. Now, you see, when I'm examining somebody like that, they're standing and their body is horizontal. Okay. And the reason I do that is because the legs will be pushing up on these iliac bones. And then the weight of the body is going to bring down the spine and the sacrum so that the iliac bones stick out more easily. And that's how I examine people who have pain in their back. And it's easy. It only takes a minute or two. And in a minute or two, you can tell what's wrong. And then you know what to fix, and how to fix it. Find out where your sacroiliac joints are. You just slide your fingers up your buttocks and you hit these little bones. And can you see how my fingers are going up over these little bony obstacles? This is how you find the level of your sacroiliac joints. Now, if one of these fingers, instead of being level, is higher up, then you know that your joint is displaced forward. You see, if these are the bones that you're looking at, the one that's going to be higher up shows that the bone is displaced forward. Now, if it's displaced forward, the way to fix it is to push it backwards. In order to push it backwards, you're going to use your thigh. Watch what I'm doing. This is how you're going to replace a forwardly displaced sacroiliac joint. You put your right foot on the floor because this is the right joint, and you lean forward hard on it like this. And meanwhile, you push your left knee backwards to stabilize the other joint. And you hold this position for 2 solid minutes. Now, supposing the joint is displaced backwards. If this finger is lower, like so, it means the joint is displaced backwards. If it's displaced backwards, you see, if it's lower, it's displaced backwards. If it's displaced backward, you have to pull it forward. Now, to pull it forward, what you do is you're going to put your knee on the floor, and then you'll put the other foot forward, and then you're going to lean forward and move that knee as far back as you can, because what you're trying to do is you're trying to pull this bone forward. If you want to pull it forward, you have to feel a real pull in your groin area. If you do that, then hold it for 2 solid minutes. If you hold it for 2 solid minutes, that'll give the bone a chance to move in the direction it should.
Does a warm up help? Like before running? Of course, I warm up, but is there anything else like core strengthening? What we can do to, have a
Well,
healthy pelvic?
actually, when you're running, you're strengthening your core. It's it's
Yes.
it's it's a very good exercise to strengthen your core. So I don't think you need to do core strengthening exercises. But if you have low back pain, you want to straighten out your back before you run. And the other thing you want to do before you run is you want to use a sacroiliac belt, because
Mm.
the belt will hold your back steady. And I'll show you what it looks like. Okay, this here is a sacroiliac belt. This is called a Sacroiliac belt. Okay,
Mm.
and what I do is I put it on here and here. It has to go on tight around the pelvis. Okay, so what you do is you have to put it here. Now notice it's low. Okay, because you have to feel these two sticky, because you see how my fingers are going over the sticky outy bones here.
Yes.
It has to be below that. If you see, you saw how the pelvic bones are made. They're made like this, okay? If you put the belt high, you're going to do this. You're going to open up those joints. You do not want to open up those joints.
Hmm.
So what's important is you put it low, below the PSISs, okay? The ASIS, okay? And then you want to then make it good and tight, like so, okay? Because that holds the pelvis. You see, it's here. These are your sacroiliac joints here, right here,
Wow.
and it tightens them right here. And then you put it here, and you've got it tight around the whole pelvis. That holds your pelvis. And that's what I would do. That's what I would always do before a run. Because if you do that before a run, then your every step you take is being cushioned by that belt holding the sacroiliac joints. And same thing, I would use the belt whenever you're going to do something that's going to hurt you. Like if you're doing a lot of picking up heavy stuff, or if you're, whatever it is that you're doing, like, by the way, weightlifters use belts to protect their pelvis.
Yes.
You see,
Yes.
well, it's the same thing. You want to wear the belt to protect your pelvis. So
Yes. And Dr. Bertrand, you showed it so well, like how where your pelvic is and everything. So with the belt, but is the exercises, corrective exercises better than the pelvic belt, or does it depend?
Well, actually, I just finished a research project on that particular subject. It's actually I compared three groups of people. Okay, one group got the belt first, one group got the exercise first, and one group just continued with their usual treatments. It could be acupuncture, it could be IMS, it could be physio, it could be chiropractic manipulation, it could be medications, it could be like whatever they were doing. I said, keep doing it, okay? And those that I gave the exercise to and the belt and then this third group, okay? And after a month, the guys who did the exercises for a month came back, and the guys who did the belt came back, and those who had nothing came back. And then at the end of that, I gave them all the same treatment, both the exercise and the belt, for another month. And so to see what would happen to them. Okay. Well, after the first month, the exercise people did much better than everybody else.
Hmm.
The belt people did better than the usual treatment group, and the usual treatment group didn't get better at all. Okay. So I know for sure that this exercise actually works better than anything else. But then I gave everybody both the exercise and the belt. And at the end of that month, everybody was better, better than they had been at the end of the first month. So obviously, the combination of the exercise and the belt was better than either separately. So that's why I think it's terribly important. And I hope that people who, especially runners who have pain when they're running, particularly, you see, if it hurts whenever your foot is hitting the ground, then you know it's your sacroiliac joint. If it hurts when you're going upstairs or downstairs and it hurts in your back, you know it's your sacroiliac joint. It can't be your spine because that joint is tasked with absorbing the shock that's happening with every step. And that's the joint that's going to complain if it's not working well. So,
Hmm. Dr. Bertrand, is there anything else you'd like to add?
well, you know something, people should also try my cream, the QR cream, if they're if they're having if they're having pain, because it is the best pain cream at the moment in the world. And I just did another research project that proves that, and because it actually takes away the nerve pain that diabetics have, and nothing does that at the moment. So
Yes.
it's
Where can they go? Where they can go on the website to find the cream, the QR cream, Dr.
yes, they can
Bertrand?
go to just go to qrcream.com, and then there's and they can, even if they're in Canada, they can get a sample for free if they go to buy now, and so they'll just push on that button and they get an offer. People in the States, sorry guys.
Oh, yeah. Well, Dr. Bertrand, like what you've given us is so valuable for our viewers. Also, too, is like getting an X-ray or MRI or taking a Tylenol. It's what you're showing us today is so innovative and so important, and that's correct.
But you know, the problem is that x-rays and MRIs are what every doctor will give you, and it gets you out of their office very fast, you see, and that way they get another visit to discuss the x-ray and the MRI. And a lot of those x-rays and MRIs, especially if you're over 40, are going to show all kinds of problems, you know, like, oh, there's arthritis here, and there's a disc disease here, and all that stuff. And yet the research projects that have been done on that subject show that there's no correlation between the pain you have and the the disc disease or the arthritis in your back. So there, and I should have sent you a picture of this guy who had 40 years of severe low back pain. Like, and he, in 3 years ago, had surgery to his back to fuse the lower lumbar spines together, okay? Because they thought that's where his pain was coming from. But his back pain didn't go away. So uh, last summer, they fused the rest of his spine so that his whole lumbar spine, this whole thing here, was fused together. And I have a picture of him with this scar that goes from here to there. Okay. And his pain continued. And in fact, it got worse because now he had all kinds of stuff in his back and he couldn't move his back at all. And all he had was a centimeter displacement between the levels of his sacroiliac joints. And when I corrected it, his pain disappeared. So he had 40 years of pain and 3 major surgeries that didn't work because it wasn't what his problem was. And this is something that people need to know.
And it's going back to before we did the interview, we were talking before, it's like the touch. It's like getting back to the
Yeah,
basics of
you
touch.
have to actually feel for those joints. And if you're not feeling for those joints, then you don't know what's happening to those joints. There's no way they're going to be seen. And nowadays people trust x-rays, CT scans, MRIs, ultrasounds. They trust that more than they trust their own 2 hands, and more than they trust what people are telling them. You know, if somebody comes in and tells me I've got pain in my groin, the first thing I'm going to think of is their sacroiliac joint level? Because you can have pain in the groin from that, particularly if you're going upstairs, because that means you're lifting up your leg, and that muscle is the one that's involved. Or if they have pain in their hips, I say, is your pain worse when you're lying on it? Because if it is, then you know that it's coming from the muscles that are trying to stabilize the sacroiliac joint. If they have burning on the side of their thigh, I know it's from a displaced bone. And this is the sort of thing you have to listen to what your patients are telling you, and you have to examine them.
Dr. Bertrand, you're leaving a legacy, and thank you so much for being on the show, and so appreciate it. And just Keep doing what you're doing. You're leaving a legacy.
Okay.
So much, Dr. Bertrand.
Okay. We'll see you then. Bye bye.